All right, everybody. Hello, welcome, and good evening. My name is Stacy Cruz, and I am the Strategic Programs Manager here at Fear Free. Thank you all for joining us tonight for COVID-19 and Curbside, the Client Communications Survival Guide, brought to you by Elanco. Presenting today is Dr. Natalie Marks. If you have any questions during the webinar, please be sure to enter them into the Q&A box at the bottom of your screen. We will have a Q&A session at the end of the presentation. So throughout tonight's talk, please go ahead and enter in those questions to the Q&A box. We are so excited to have Dr. Marks here with us today. So on that note, I will pass it over to you, Dr. Marks, and we will go ahead and get started.
Great. Thanks so much, Stacy, and good evening, everybody. Thanks for taking time out of your night to be with us. I'm really excited to talk about this because COVID and curbside are two things that to me have certainly not been a welcome part of being a veterinarian. At first, it was a huge struggle for us to figure out a workflow and an efficiency, and most importantly, this sort of client survival guide, right? How do we get our clients used to and embracing this very different way of practicing without receiving sort of those consequential complaint calls afterwards or negative feedback or just be really frustrated and destroying the bond that we have with our clients. So I'm excited to come tonight with some ideas that I have. I absolutely welcome your ideas too. I'd love for this to be things where if you have something that's really worked for your practice, to share it in the chat. Because one thing that's really awesome about the Fear Free community is that we are collaborators. We all like to help each other and make a difference so that this movement can continue its momentum and we're preserving the physical and emotional health of our patients and our clients and ourselves. So if something comes to mind, or if you're like, that's a great idea, but here's what we do and this really works, throw it in there, because I'd love for us to kind of have this be as active as possible, even though it is a webinar. So again, thank you for being part of this tonight, and we'll get started. Just a little bit about myself quickly, for those of you that don't know me. I have been in practice, it was my 20th year. Practiced in Atlanta for 5 years, came back to Chicago, bought Blum with a business partner of mine for about 10, and have recently scaled back so that I'm doing a lot more educating and consulting. Teaching is a huge passion of mine, as well as mentorship. And so I'm really excited to be here and helping with that cause. Fear Free is a very important part of the way I practice. I am a huge believer in everything that's aligned with that, and certainly the mission of the preservation of physical and emotional health of our patients is something that we hope will continue as widely spread as it can be. And I know all of you joining us tonight feel the same way. So I have 3 kids at home that hopefully will not be FaceTiming me throughout this lecture. I've already had 3 declined calls. I've survived a year of virtual learning with them at home. I don't know if any of you have had the same stresses. I also have a menagerie of furry family between a dog, a hamster, 2 guinea pigs, a chinchilla, 3 frogs, and 10 fish at home. Tried most recently, my son tried us to get chickens inside. I think we have enough going on. I'm a foodie. I love movies. I love working out. I did love traveling when we could do it, but I also very much love being a veterinarian and being in our industry. So if any of you want to share anything about yourselves, I love networking and meeting people around the country. I hope to, at some point, that we can meet in person. So let's get started. Let's figure out a little bit more about this curbside. And a disclaimer, of course, this presentation is sponsored by one of Fear Free partners, Elanco. We're very thankful for their commitment to ongoing education. So did anybody feel this way last year? So I feel like that's sort of how I left practice many days. I was frustrated with COVID. I'm frustrated with sometimes our team members. I'm frustrated with clients. I'm frustrated with just a lot of the changes that, of course, were just thrust upon us. And certainly also just sort of the unknown, right? We didn't know for a while if COVID was something that was going to transfer easily to our patients. There was a lot of frantic hysteria. We didn't know how long this was going to go on. We were worried about our own health. Hopefully many of you have been vaccinated. But as essential workers, right, these were trying times, and life has gotten better since then. But this is, a lot of days I would come home and just sort of collapse and say, I don't know how we're doing this. And that's not how we want to feel, right? A recent survey showed that most people prefer curbside service. Is that true or false? If anybody wants to guess, certainly feel free to throw that into the chat. But this is really a surprising answer, because actually this is quite true. In recent surveys, a lot of our clients are showing that they actually are fine, in fact, prefer to stay in their car and have things brought out to them or serviced at curbside. Now, I would argue most veterinarians were probably not surveyed in this. And I've heard mixed feelings, right? I'm sure there are a lot of people like myself who prefer to actually see clients in person. I prefer to not have some of the inefficiencies that take longer, right, at curbside service. I prefer, as we'll talk about tonight, to have body language in front of me so that I can actually communicate better with my clients. And I like my clients for the most part. I like people and I like getting to know them. I would say some of my team members are very happy not seeing clients, and that might be you. You feel like you can be more efficient, or you really are one of those people that just prefer to work on the patients and have other people do the communication for you. We're sort of a mixed bag, but what we have to realize is that our clients, most of them do prefer what we're doing now. So does that mean that we stay curbside forever? Or does that mean maybe we take this and have some type of modification to make sure that our clients have the experience that they want? Well, tonight we're really going to focus on 5 key components of the communication. And this is not just for practice. This is something that I feel can really spill over into our personal life too. How we communicate with our team members, how we communicate with friends, at home, with professional colleagues, wherever you want to use this. I've tried to use some of this also with my kids. I certainly think, of course, their age depends on how much they understand, but I do think that the 5 components of communication you can really apply to almost all aspects of life. And they are transparency, empathy, self-awareness, context, and flexibility. And we're going to go through these together one by one tonight and try to understand how they apply to how we practice. So let's start with transparency. Very transparent. This is a picture of Blum many years ago. This is pre-Fear Free, which you're like, thank God, because if that's your Fear Free hospital, what are you doing, right? But this is what we used to do. So I'm downtown Chicago in an old brownstone building. That's where our hospital is. And you can see there's cats and dogs and people just smushed into our lobby, waiting for appointments. And this was our whole lobby for many years, almost 68 years. This is what it looked like. So when you think about that, if a new pet parent could see this now, right, they might be like, whoa, that's overwhelming. And that's definitely not a fear-free hospital, right? So, but it's important to have transparency because that's how we build trust. We have so many new puppies, right? The pandemic puppy wave is incredible. In a survey of 1,000 dog owners on rover.com, 60% of them were first-time pet parents. And none of them, unless you're starting to see patients, but here we're not still, none of them have been inside your hospital. So we have to put ourselves a little bit in their shoes, right? So they've never owned a pet before. They've never obviously seen a veterinarian before. They have no idea what to expect when they give their brand new puppy to a technician, a nurse, an assistant, whoever is doing that curbside transfer. And then all of a sudden the puppy's gone and they're kind of frantic, right? A lot of them, that creates an anxiety because they just don't know what to expect. So it's our job, and I know many of you are already doing this, but it's a good idea to kind of relook at your why. Telling your story so that you're as transparent as possible about what is happening inside your hospital. And we do that through many different media. So we can do social media, doing quick 15 to 30-second videos of, let me give a quick tour of our exam room. This is where your puppy's going to be for their first visit. This is our cat-friendly area. This is where only cats go for exams. This is our dental suite, whatever you want to do. But it's so important for our clients to see what goes on behind the scenes. You might be saying to yourself, our clients know, right? Dr. Marks, they've been there before. You have so many new pet parents who have it, and we have to remember that. It's almost sort of starting from scratch and retelling your story. You can use e-blast, sending out very important information to those first-time pet parents, and certainly utilize your website. Take new pictures and post them. You might think, well, why do I need to post our reception area? Well, at some point, your clients hopefully will be back there, and then it won't be something foreign to them. As fear-free certified hospitals and team members, it's so important for us to show what makes us different. What are you doing in your hospital that is fear-free? Because these first-time pet parents have no idea even what that means. And it's important that we show them what we do, so then we can teach them what they can do at home. The curbside changes that you're doing, make a video, a quick little selfie video of, if you're a new client, this is what to expect. We've done that a couple times with some of our team members, walking up with a cat or parking with a dog or showing your parking lot. And when you pull up, this is where you're going to park. These are the signs. And someone's going to come up to you and greet you. And this is what's going to happen when we come into the hospital. I know that sounds simple and basic. It's so important because then a client has already seen and visualized their experience there, and they're expecting it. And then as long as we're doing that, we want to promote that consistently. So don't do one video and think that that's it. On social media, especially, we want to refresh that. Don't forget, we're still curbside and this is what's going to happen. And keep coming back to that, at least a couple times a month, because you're getting new clients all the time. And we want to make sure that everyone feels supported there. So on that pre-appointment communication, it's so important, if you're not already doing this, to utilize digital signature platforms. So there's Snout ID, there's JotForm, there's DocuSign, there's all kinds of different modules that you can use that help a client receive information, pre-surgical, pre-dental, pre-sedation blood work, whatever, or signage, whatever it is, so that they can sign prior to the appointment. We receive that paperwork and can get that process much more smoothly going. As I mentioned, labeling parking, your parking spots, so clients know exactly where to be. If you're a practice like ours, we have a parking lot, but a lot of people park in front, sort of in a valet style area. That signage needs to be very visible. And then the thing that a lot of us have not done in the past in veterinary medicine, but something that we need to do, which is embrace texting. I know a lot of people say, oh my gosh, do I really need to text my clients? Well, this is the thing. In studies that have looked at texting in medical professions, so human medicine, dentistry, physical therapy, so on and so forth, who are utilizing texting, it's a 99% open rate on average, and 95% of those texts are read in the first 3 minutes of receipt. That's really incredible. If we're trying to communicate to a client, and I don't know how many of you have the same frustration with voicemail that I do, but when I call a client now, most people don't answer their phone, right? They're either screening their calls, they're on another call, or they're waiting for a text or an email. So a lot of times the fastest way to communicate with a client in an exam, after an exam, going over blood work, or certainly an emergency, is to send a quick text and say, this is ABC Animal Hospital calling, this is Dr. Marks. I need to reach you about Fluffy, please call back immediately. Or this is what we're finding, do we have the okay? There are a lot of different services out there that allow you, of course, to do texting without it coming from a personal phone. Google Voice is probably the easiest one out there, but lots of different ones. We use Ally DVM, lots of different partners to choose from depending on your needs and your customization desires. But very, very important, if you're not already doing this, to see clients today do not want to talk on the phone. They absolutely want to text. It's also a great way to clarify the hospital arrival process, because Clients don't see this anymore. We spent a ton of time and money renovating our lobby to make it a fear-free certified hospital with a separate cat and dog area. Our cat area, you see, of course, the cat carrier parking here, we rarely use anymore. We're hoping certainly that clients will be back, but we don't know when that's going to be. And we want to make sure that clients understand that part of our fear-free strategy is that our cats are not on the ground. And that's something that we want them to do at home, right? We want them to utilize their cat carrier all the time. We want them to embrace the carrier as furniture, and we want them to understand cats like to be elevated. They need to be up high. We need to be feeding them up high. We need to be giving them puzzles up high, giving them cat trees, giving them windowsills, but they don't see this. So we can utilize and send texts, pictures, send videos, all kinds of things, again, through a texting mechanism to get our clients that transparency that we want them to know. So standardize your check-in process. They don't want to wait on hold. They don't want to talk on the phone. Email arrival instructions when you confirm the appointment. Like I said, labeling the stalls and then having those adjustments on your workflow so all of your team knows, again, exactly what's going to happen when clients arrive and also the reverse when they check out. And the more that we can do that, of course, and have a consistent message, the happier our clients are going to be. Number 2, after transparency, is empathy. I would say as a profession, we are probably, outside of maybe funeral directors, the most empathetic people on the planet. Veterinarians and veterinary technicians, nurses, and veterinary team members. I haven't met another group of people that on a daily basis are willing and able to show empathy. But we have to understand that empathy does not always come across in a way that clients receive it. So what I mean by that is that when we see a mouth like this, the first thing I go is, oh my God, that poor dog, right? Can you imagine the pain that this dog is in? I just want to get into the dental suite, in an hour and get this mouth healthy. When we are communicating to clients over phone or text, sometimes empathy doesn't come across as well as it does in person. And clients aren't hearing our recommendations. In fact, AHA, when they've done recent studies, this is a little not as current, but certainly still very, very practical and applicable. 48% of clients do not remember hearing a recommendation about heartworm prevention. 35% didn't remember hearing a recommendation about a dental pro fee. And 19% did not remember hearing a recommendation for prescriptive diets. Those are really important recommendations that we try to convey in an exam. If they're not hearing that, unfortunately, what ends up happening? Nothing, right? Either we get frustrated and we go, oh my gosh, doesn't mom or dad realize how painful this mouth is? And we start to lose empathy, or we still have it, but we choose not to convey it. So that's why it's so important to understand we have to think of a different way to communicate to our clients so that they recognize our empathy so we don't burn out too. This is a really awesome technique that Bayer Animal Health Communication Project developed, and I absolutely love it. I hope if there's only one thing you take away from this that can maybe help with our curbside challenges, it's the inhale-exhale technique of communicating. We all know what inhale-exhale is, right? It's deep breathing, certainly a de-stressor, way to meditate, yoga. However, this is a way to pair a breath with understanding how better to communicate and listen to clients and deliver communication. So the inhale part is, and if you can kind of imagine me taking this deep inhale in, I'm going to listen to my client's story. I'm going to listen to their thoughts, their feelings, their values, their morals, their ethics, whatever is involved in our communication there. And I'm going to put myself and imagine the position they're in. So let's say we have a dog that's hit by a car and a client that says, I have $50, right? Imagining that poor position of the client who is now in this emotional state because their dog's been hit by a car, and they may have feelings of guilt or other emotions because they maybe can't pay for the care that they want to provide for that pet, right? So these are all things that we take an inhale. An inhale means we aren't talking during this. And I'll get to that in a minute. That's a very important part. We're inhaling and listening. Our exhale is our verbal and nonverbal communication. It seems very simple. It took me a while to get to feeling comfortable doing this technique, but I think it is really important to understand that we're not only taking the time to listen to our clients, we are relaxing ourselves so that when we deliver communication, both verbally and non-verbally, it is in a calm and comfortable and empathetic way. Not one that's rushed, not one that's an interruption, not one that has judgment communicated in it, but in a way where we are relaxed and again, have listened and taken in and the client feels heard. So let's apply this inhale, exhale technique to vaccine empathy, okay? And I don't think this is a concept many of us have thought about before, because I can't even think of how many thousands of vaccines I have administered in my 20 years of practice. But it's something that for me, it's really sort of changed how I think about this. We have a brand new pet parent, never had a kitten before, okay? Brings in their kitten for a 8-week exam, and we tell them we're going to vaccinate the kitten while we're doing a lot of other things. Takes the kitten home after the exam, doesn't have a ton of communication, and all of a sudden that kitten is hiding in a closet the rest of the night, and when touched is painful. What does that client feel? Well, the client is scared. The client is maybe anxious. The client feels sad for the kitten. And then what could the client think? What happened during that vaccine? Did they do it wrong? Did the veterinarian maybe give too much? Maybe they didn't give the vaccine at all. Did they drop my kitten? Oh my gosh, I'm going to call, right? I mean, this spirals down a rabbit hole. And I'm sure many of you have had this because the client isn't there. So when clients are calling, especially first-time pet parents with vaccine concerns, I think it's important, again, to inhale, listen to the client, hear their concerns, imagine their position. They've never had a pet before. They don't even know what a vaccine looks like. They don't know what to expect after a vaccine. And then exhale and have those verbal and nonverbal communication cues given to them in a calm and empathetic way. It's very important to do this. And again, we're talking about vaccines here, but I think empathy in this inhale, exhale technique can translate to almost any client concern that they have. So I want to talk about just briefly, I know this is a bit of a busy slide, but these comfort points, right? Let's say this happened with a kitten named Emma, right? And the client calls back the next day, pretty furious and upset and emotional. I empathize with your concerns about Emma feeling painful from vaccinations and also maybe that they're not safe for her. I empathize with that, right? I've worried about that myself as a veterinarian or a technician or a nurse or a care coordinator or whatever staff member is talking to this client. When we are choosing vaccines, safety and comfort are so important to me and our team. That's why I'm recommending this vaccine. That's a very important thing to say at the time of the exam. Because while we might receive these calls previously, the goal of tonight is for those calls to never happen again. Because we want to remember that can happen and proactively talk about ways that we choose to vaccinate our patients so that they are comfortable and they do feel good when they come home. And we do communicate potential side effects afterwards, like being tired or soreness at the site ahead of time. But when we choose things like the half-mil vaccines, which we all know, of course, are really designed for comfort, half the volume of other vaccines means that our patients are going to have half of the traumatic trauma, of course, of having a vaccine volume administered under the skin. I think when you say that I would choose this for my own pet, I see the value in this. It's made with PurAfill technology. This removes extra proteins and debris, so this vaccine is as safe as possible. And the reason they do this is so there's much reduced risk of reaction. I know that's very important to you, Mrs. Jones. And for me, it's very important for my own dog. When we communicate that and have empathy first and foremost, then our clients understand, number one, we've listened to them. Number two, we empathize with their concerns. Number three, we are going to address those concerns and show that those concerns are part of our value system too. And number four, we're going to explain again why this is going to make their patient or their pet more comfortable so they have a better experience at home. These are all very easy talking points that I would encourage everybody in the practice to be using when clients call and have those kind of concerns. Third thing, self-awareness. I love this picture because obviously they need to be a little more self-aware of their size coming through. And this is Penny and Charlie, two sweet, fear-free patients. I don't know if you knew this, but 93% of communication is nonverbal. 93%. But our clients may not see us at all during the visit, and we may not see them. I think that has been the biggest challenge, right, of curbside communication is that 7% of what we communicate, our verbal words, is such a minor part of how our clients receive a message. The other thing that's part of that, and this is to me that I feel awful about this as a veterinarian, but studies show veterinarians interrupt their clients in 15 seconds on average. So you can imagine a client starts talking, they're telling the story, and I found urine out of the box, and it's the second time it's happened, and there was a little bit of blood, and then all of a sudden, blurb, there we are, ready to jump in. It breaks down our veterinary client-patient relationship and the trust there, and it actually increases our time in that exam because we didn't let the client finish. We've interrupted. We might have had, our blinders on, and it's got to be fluted. But then the client says something else about vomiting, and then we change our tactic, and then we're asking different history questions. It really extends and makes us inefficient rather than making us more efficient. So and this is something that I've been very conscious of now in my communications with clients is inhaling and not interrupting. And I've even timed myself to see if I can get past that 15.2 second mark. And I encourage you all to do the same. It's a really great way of keeping yourself accountable and being self-aware. So knowing this about nonverbal communication and also knowing this about our interruption tendencies, that's why video chat is such an important piece to add to your exams if you're not already doing that. It's eliminating that duplicate phone call a lot of us have to make afterwards. It actually has been shown to save 10 to 15 minutes per appointment. That's insane if we can save that much. And it drastically improves client understanding because they're able to see our nonverbal cues and we are able to respond to theirs. If you want to screenshot this, this is a part of the AVMA resources for us. It shows all of the video chat options that are providers in a nice, beautiful list PDF. So feel free to screenshot that and go to that for more information and resources if you're looking to add video chat to your examinations. Oh, I'm sorry about that. The fourth part of communication, of course, is context. If I told a client we're going to use a calming cat towel, and they said, I have no idea what that means because they're not in our lobby right now to understand it's a pheromone impregnated towel that goes over the carrier and helps reduce stress, anxiety, and fear. I mean, again, out of context, a new cat parent would say to me, I have no idea what you're talking about, or just sort of go, and not understand what we're trying to do to help their patient. So what we need to do is demonstrate the difference, teach them, again, about fear-free practice, and highly recommend utilizing social media for this. Think of all of the things that are now part of the way you practice as a fear-free certified professional and as a fear-free certified hospital. They become rote memory to us, right? Because they're so ingrained in habit. But for new pet parents, they have no idea about high reward treats and warm towels and the music from I Calm Cat and I Calm Dog, low stress handling, considerate approach, touch gradient, PDPs. Think of all of the lingo and sort of the new workflow that we incorporate into every patient's care as fear-free professionals that new pet parents and maybe some of your older pet parents really don't know about or they don't remember. So it's very important that, again, video chat can absolutely add to that because you can show that as you're doing the exam. Now, context also applies to difficult client conversations. And if you've been able to get through up until now in practice and never have a difficult client conversation, I want your life. Because I, as a practice owner, as a manager, as a medical director, as a veterinarian, I have had my share of difficult client conversations. What I want you to remember is this: we have to use that inhale, exhale technique and think about the context. Because a lot of times when a client calls, they may be talking about problems that are out of your control, right? Something about their own finances, something about their own personal relationship or a custody battle, things that are variables that play a role in their decision, but are totally out of your control. They may be so emotionally distressed that they're not in the right frame of mind to have a rational conversation with you at that moment. They may be using irrational language, disrespectful language, very inappropriate language, or having unreasonable demands. That is not your fault. Absolutely not your fault. And they may, unfortunately, also have ignorance to the medical issue at hand. They may have inaccurate information. They may be believing things that are completely inaccurate. They may be questioning your medical knowledge because they found other web-based information that is inaccurate, but in their mind correct. These are all client conversations that impact us on a day-to-day basis. What I want you to remember, though, is that some of these client conversations can be postponed. Some of these client conversations you do not have to be part of in that moment, especially in the irrational language and unreasonable demands. Instead, let's think about contextualizing and having conflict resolutions with clients that we can have rational and respectful conversations with. It's very hard to do. I know I'm in the moment, and when somebody is making unreasonable, and should I say, maybe accusatory demands and insults towards you or your practice or team member, it's very easy to get defensive and frustrated, but we can't. We need to take, again, the inhale, exhale technique and listen first. Take deep breaths, acknowledge the client has a concern. It may not be valid in your mind at that moment, but they have a concern. And so we can at least acknowledge that concern exists. We can place a problem into context. And the goal, again, is to work together towards a solution. When I'm on that call with a client, that's the first thing when I'm done listening is I say, I acknowledge that you have a concern. And our goal always is to work towards resolution. That doesn't always happen, right? There's some clients that we're going to be at a stuck moment of agree to disagree, and we have to go down a different pathway. But the goal is to work together for a solution. Once clients hear you, that you've listened, you're not defensive, you're not deflecting, you're not getting frustrated, you've acknowledged the concern, and you have a goal, most of them are reasonable enough to listen. But anxious clients need reassurance. I put this up here, right? Because if I didn't have any kind of monitoring device when I do surgery, I would be anxious. We don't know how our patient's doing. We don't know blood pressure, heart rate, respiratory rate, oxygen level. We have no idea, right? It's a very sort of kind of limbo place to live, right? Our clients, especially some of these first-time pet parents, they need reassurance of what's happening. And again, e-blasts to clients are a great way to do that. Social media updates, signage on hospitals, especially for clients of yours that aren't tech savvy and really prefer, again, to see visual demands, or mailing to some of those older clients, again, that may not have been, they may not be jumping on the technician bandwagon that we all are. And for some of those clients, I know it can be a little bit of extra work, but visit summaries are important. Discharge instructions have to go with every patient who has had sedation or has had an oral surgery or a surgical procedure or any kind of hospitalization. It's important not only for clients to feel less anxious and more prepared for compliance, it's essential, right? It's part of the medical record, and we need to have that client feel reassured. Exam report cards, prescription information, next appointment, hospital resources. How can they get onto your online pharmacy? How can they order from you? How can they reach a veterinarian? These are all things that need to be accessible to your client. Now, if you're looking at this and going, I'm overwhelmed, Dr. Marks, I can't do all of this tomorrow. I know you don't have to do it all tomorrow, but these are things to aspire to at your practice. These are great goals to have for different team members to establish an SOP, right? It doesn't have to be done tomorrow, but this is something that I want you to think about and go through on your checklist. How can I make these goals by a certain time frame? And then finally, the thing that I've had to struggle with the most, which is flexibility, right? I am a very structured person by nature. And so for me to sort of flex and adapt and go with the flow, that is a challenge. And I'm actively working on it, but I would assume a lot of us are probably that way. But we need to be flexible and be able to alter that physical exam, right? We don't have to do it on the table. We can do it in a lap, a carrier, creative positioning, held in the arms, on the floor on a non-skid mat, with, you have a wonderful technician or nurse that's holding that patient. What a great way to capture the bond that we have with our patients and send a text to that client quickly and say, you know what? Look at Bianca and Henry. They're so happy right now. Nothing to worry about, Mom. That one text and picture can go so far building the trust with that new pet parent. Now, I put this in here, and again, not suggesting truck stops for every patient. This was a patient of mine when a client asked me, and you'll see in the middle picture, you can probably visualize that drain hole at the very bottom. This was a dog that had a bite wound, and they lived off an exit very close to where I was going to visit for a weekend. And they said, Dr. Marks, I overheard you saying that you were going to be out this way. And I was just wondering if you could stop at the travel center truck stop and take Bush's drain out for me in the backseat of the car. And I thought to myself, my reflexes, I said, oh, sure, no problem. And I thought, why did I do that? It took 5 minutes. It was not a big deal. And they gave you a beautiful bottle of wine after that. I'm not suggesting that for every patient, but what I am suggesting is that we need to be a little bit more flexible, thinking about how we schedule. So many of us have really benefited from having drop-off appointments. And if your hospital is not doing that, I want you to consider that. It's actually great for us. You can take more time. You can work it into your schedule. You can use PVPs appropriately. You don't have to rush sedation if you've been doing that. It's really nice to think about how can drop-offs be part of our workflow. If you're not doing feline-specific clinic hours, think about that. A lot of people do Wednesdays for cats. It's only cat appointments. And what a great time for cat parents to get to know you, right? You're showing, hey, I'm focused on the cat right now. We have feline-focused hours. It's feline happy hour at our practice. It's a great way to show that they're not second-class citizens. And that happens so frequently, inadvertently at practices. Follow-up phone calls, texts, and emails. We need to be doing that with all of our patients, but we have flexible scheduling. You can send out texts more automated there. Appointment reminders, again, please utilize text. Embrace the text. I think the whole world will be texting, even some of our seniors. I have 90-year-old clients that are asking me to text. So it's really important to communicate that way and reinforce why rechecks are so incredibly important. So we've gone over those 5 communication pieces. I see there's some questions coming in, so I want to make sure that we can have some discussion too. But before I end tonight, 2 things. One, this is my email. I absolutely love networking, again, with colleagues around the country, especially about fear-free medicine, which is very near and dear to my heart. So if we don't get to your question or you want to discuss something privately, please feel free to always utilize my email. I'm on it probably more than I should be, but I will get back to you as soon as I possibly can. And I want to be able to help problem solve at your practice. But most importantly, it's been a very difficult year, not only physically for a lot of us working long hours, but mentally. I love this quote from Anthony Hopkins: none of us are getting out of here alive. So please stop treating yourself like an afterthought. Eat the delicious food, walk in the sunshine, jump in the ocean, say the truth that you're carrying in your heart like hidden treasure. Be silly, be kind, be weird. There's no time for anything else. I really want to stress to all of us, including myself, that we need to have self-care. It is one thing to be giving, giving, giving all the time, which is what we do as veterinarians and veterinary professionals. We give to our clients, we give to our team members, we give to our families, we give to our patients, we give to everyone. Please, please take time out of your day to take care of yourself. There have been way too many of our colleagues, our friends, our mentors, our mentees who have not done that. And we've lost way too many to this. So please, I encourage you, although we're talking about communication tonight, I just want to end making sure that everybody out there is taking care of themselves, taking time out of their day for stress relief, taking time to connect to friends and family, and to make sure that you're taking care of your own mental well-being, because our patients' emotional health is important. Ours is too. So thank you very much. I appreciate all of you being part of this. I'm going to stop. Actually, I'll leave this up for a few more minutes, but it looks like we're getting some Q&A, and I'm going to hand this back over to Stacy to take over and start some of our discussion.
Thank you, Dr. Marks, and thank you for such a great presentation and for reminding all of us how important it is to take care of ourselves. We all know that we can't pour from an empty cup. We do have a lot of questions here tonight, so I would love to get started on that.
Great.
The first one was about conveying empathy to emotional owners when they leave negative reviews online.
Oh, it is very difficult. And I empathize with you on whoever is asking that on that question. I would give you 3 tips for that. So the first thing is we never respond right away. That was a habit that I had to break for myself very early on in my career, because somebody writes a review, especially if it's a personal attack about you, it's very difficult to see that online and not want it taken down immediately, or to respond immediately and defend yourself. We can't do that. We have to let it breathe. We have to inhale and exhale, because an emotional response only damages you. It does nothing for this client. So let it breathe for a little bit. Take, 12 to 24 hours to sit and write things down yourself, talk to your team, talk to your mentor, whoever you need to gather your thoughts. The second thing is I do not initiate conversation with a negative review by adding a review. The first thing I do is I try to call that client myself. It's a little surprising to a lot of clients if they get a call, and you'd be surprised how many clients take the review down after a phone call. They expect you to just do some kind of verbal regurgitation online. They don't expect a lot of times to have to talk to you in person. And if you take the time to talk to them in person and say, Mrs. Jones, I wanted to call you and thank you for picking up the phone. I saw the review that you left, and it was, very hard for me to read, but I empathize that you had a concern, and I was hoping that we could talk about this right now. It does 2 things. One, it calls that client out. A lot of clients, like I said, it's easy to, to be that backseat driver, right? Get in their pajamas with a drink of their choice and write something negative online. It's a lot harder to have to talk about that. And sometimes it's, something where the client goes, gosh, I feel bad. I should have just called you, and they take it down. The second thing is it shows them that you are human. And I think that's unfortunately what has happened to a lot of us, is that these reviews, like I said, it's easy to write to a computer screen. It's not easy to say that thing to a person. And when we show that we're human, and we show that we care, and we show that we have empathy, many of these clients, again, will apologize. They will take it down. They will amend their review. A lot of people will even say, I can't even believe I did this. I'm so sorry. I'm not going to say that works for every single one, but I would say for me, in my experience, 90% of the time, we can either have it amended or we have the review taken down because we try to find a resolution offline. So I would say that's the best way to show empathy, is to not be defensive and immediately blast another review back, and to call that person. And again, it doesn't have to be you. It could be your practice manager, your owner, whoever is in charge of conflict resolution, but call them. Don't just write something in return. Call them and have a person-to-person conversation. if you're taking clients in, ask them, I'd love to sit down and have a cup of coffee with you and figure this out. Clients, again, are not used to having that. And they're surprised. And a lot of times, again, it just humanizes us. And that's what we need to do.
Thank you for that, Dr. Marks. All right, next question. With new clients, we're experiencing a lot of anxious dogs that don't want to come into the building with us. What's the best thing to do in that situation? Do you allow owners to walk the pets to the door? How do you approach that?
Yeah. I think, it's kind of hit or miss, right? With our patients. So we've had some anxious patients maybe that you've seen forever. Now, all of a sudden they're away from their parent and they're like a different dog or cat. And then we have the flip side. We have tons of new pet parents, remember, who have created these separation anxiety monsters because of COVID that we're all going to be dealing with now that people are starting to go back to work. But many of them also do not understand anxious body language in dogs. So I think there's 3 things that you can do. One is constant reminders to clients. What does anxiety look like in your dog and cat? Body language diagrams, showing videos. Is this your dog, right? Anxious behavior. Why does a dog yawn? It's not because they're tired, they're anxious. Reinforcing what clients need to look for at home. Number 2, it's that pre-appointment checklist, right? What strategies are we giving to pet parents so that the pets are not arriving anxious? Are we giving them travel guidelines, music in the car, pheromones, thundershirt? Do they need a PVP? Whatever the strategy is. And then if that's still not working, if they're anxious to leave the pet parent, then some of those pet parents we have, they will walk to the door, and then we do a high reward treat transfer, right? So we have a high reward treat. We're giving that to the dog as we're doing the transfer of the leash and walking them inside. But I think most importantly, it's that proactive preparedness that we give our clients ahead of the exam, because so many of them are, grabbing their cat the second before they have to leave, shoving them in a carrier, bringing them in a very stressful car ride or on public transportation, or the same thing with a puppy, right? The puppy's jumping all over the lap, has no restraint in the car, is panting, has their head out the window, they're playing loud music, they're talking loudly. I mean, all of these things, pet parents mean well, but they just don't understand that these, completely unintentional ways of making dogs anxious are also stressing them out when they arrive at the veterinary practice. So I think those are strategies to think about. And if it's an anxious dog and it's been, a repeat offender, these are dogs that need PVPs before they come in. And again, we're stressing to our clients, PVPs should not have a stigma. We're not telling our clients there's anything wrong with their patient or their pet. We're telling them your dog is anxious. Have you ever felt anxiety? Public speaking or traveling. It's not a comfortable feeling, and we want them to feel relaxed so that when they come here, they can establish, again, a powerful, positive memory in their amygdala, not a fearful one.
All right. The next question here we actually got a couple of these, so it seems like it is a prominent topic.
Okay.
As restrictions via the government are opening back up, if your hospital is not comfortable and considering it safe to have clients in the building, how do you address that with clients that don't agree with it now that capacity restrictions are being lifted?
Oh, I think that's going to be something that we are going to be dealing with for some time, right? Because there's such a varying degree of what's called openness, right? Today, especially by state, by city, by business. So I think it comes down to a couple things. One is, can your building, your clinic, your hospital, can it support social distancing? I will tell you, our practice, it's going to be very challenging to support social distancing, which is still recommended by the CDC. I think that there are going to be creative ways that we can think about if you are in a climate that allows outdoor exams as a transition piece to when maybe it's a little bit safer to have people inside. I think flex scheduling is a great way to think about that, allowing drop-off appointments, again, for convenience. We're addressing that new pet parents' desire for convenience. So rather than saying, well, we don't want people in the building so you can drop off, we're saying we want to have a convenient way to see the veterinarian today. So let's schedule a drop-off appointment and let's schedule 3 o'clock for when we can talk, right? So I think that's another way to address it. I think ultimately it depends on your management team and your ownership and the comfort level for the safety of their team. My hope, of course, is that most of us, I'm vaccinated, most of us as essential workers will be able to, if we're comfortable, of course, be vaccinated and have that, little added layer of protection, still be wearing masks and obviously still want to be social distancing around unvaccinated people. But, again, I think it's all in the way we convey it. We don't want to be defensive. We don't want to throw it back on the pet parent. We don't want to blame somebody else for that decision. I think there's a way to communicate that to the client. And again, think about flex scheduling, think about outdoor appointments. If that's, we have a tent that we've used to have outdoor appointments, if you're able to do so, certainly with weather permitting, and if you feel comfortable as a team. Thinking about different ways within your practice to utilize different spaces. Maybe your lobby becomes exam rooms, right? To have spaces. Maybe a conference room becomes an exam room so that you have more space. The beauty of COVID, if there is, I guess it's strange to say that, but the beauty of COVID is we can think out of the box. We can be creative now. We don't have to do things the way we used to do in the industry. You can come back to your team and say, hey, this exam room, I don't want to use it as an exam room anymore. I'm going to use it as a lab, and I'm going to use this larger waiting area as an exam room so I can be with a client and have social distancing. It's totally cool to do that. So I guess I would encourage you to talk to your management team, see what your strategy is. And we don't have to go from seeing no clients to seeing all clients tomorrow. We can unveil it as a transition depending on your comfort level.
I love that idea of repurposing existing space. I think that's fantastic. Somewhat of a follow-up question, even though it was asked at a different time, but in relation to doing drop-off exams, do you charge an extra boarding fee for the day when you have pets that are dropped off?
So we currently don't. I guess I have two things to say about that. So one is that, we initiated the drop-off appointments. The clients didn't ask for this. It's not something that, add on a nail trim, right? That kind of thing. We initiated this. So this is a service we are providing our client that makes us different. And I think that's very important because when a client sees the difference and sees the value in it, they are usually more willing to listen to you and recommendations. I also have found that clients are more willing to do more services because the pet is already there. So as an example, I do an exam and I notice there's a mass on the right hind. And I say to the client, before maybe we did a fine needle aspirate that we sent out, we have point of care cytology. So I say, well, if you don't mind, Mrs. Harris, I'd love to do a fine needle aspirate and figure out exactly what's going on with this bump on Shelly because I'm concerned. And the beauty is Shelly's here. So I can do this and I'll have a result in about an hour and then we can figure out what we need to do. Well, within that hour, I can find out maybe that's a mast cell tumor. Maybe I need to stage that patient. Maybe I need to get lab work. Maybe we need to do, an ultrasound, whatever the case may be. And clients are like, well, he's already there. I'd love to get this all done. I'm really busy the rest of the week. I've got to pick up the kids. I've got to travel, whatever that is. It's really nice to think about, I'm going to just follow this whole case out. I'm not going to break it up in stages and do this over 4 weeks. So a lot of clients are really happy to think about that way, that kind of positioning. You know what? Let's just get this all done. Let's go. I want to find out what's wrong with my dog. I don't want to wait 2 weeks to find out if there's cancer. I want to find out now. So by not charging and kind of creating this sort of bad taste in their mouth about a boarding charge, instead, we're creating what's called incremental revenue, right? We're building on tests by good medical recommendations. The client compliance has increased, and instead we're actually doing better that way. So I think if you kind of think about it, not so much in the actual moment of that transaction of the day, but what it does for the practice health and the patient health, by not charging, you will find you'll more than make up for that revenue.
All right, next question here. It's important at our hospital that we present estimates to clients after the preliminary physical, but before we continue with treatments.
Mhm.
While that paperwork is being generated, reviewed, and communicated, we usually have the patient waiting in a cage. Any workflow tips or ways to minimize stress when we have patients waiting during that communication portion of the exam?
Sure. So I guess the question would be why they can't be in the exam room. And I certainly, whoever's asking this question, please feel free to contact me afterwards because I think this is probably a back and forth conversation that we need to have. Um, we have the patients stay in the exam room as long as they're in the hospital. If they're in the active exam, right? So they don't go from the exam to a treatment table for blood work and then a holding cage and then x-ray and then up to another room, or we try to keep them in the same space, right? Because pets do better when they're acclimated to one space, especially cats. So I think for this question, probably the easiest thing is if you can email me directly, because I need a little bit more information and I'm not able to get that obviously in a webinar presentation format, but I'm happy to work through that with you because I have some ideas in my head depending on what the answers to some of my questions will be.
All right, this one should be easy enough for you to answer. I noticed that you're credentialed as a CVJ. What does CVJ stand for?
Yeah, it's a certified veterinary journalist. So I do a lot of writing. I have several columns, a lot of SMT, which is satellite media tour media, a lot of live media. I do quite a bit communicating to within the veterinary industry, but also to pet owners. So I really enjoy obviously teaching, but just basically communicating what we know in a way that pet parents can understand. So I've really enjoyed that part of it. And I've done that probably the last 3 years.
That is so cool. I'm very envious of that. That sounds so
Very fun.
incredibly awesome.
Yeah.
Next question here. Approaching situations where a client brings a cat to curbside drop off without a carrier.
Oh, I know. I'm just saying, oh, because we've had that too. So a couple things with that. One is, as much as we try to have that proactive communication about how to prepare for the exam, you're always going to have that client, right, who doesn't listen, and despite all the efforts, they show up without the carrier. So a couple things we need to remember. One is I'm assuming that this is a cat that comes in a car and not somebody who's just carrying the cat down the street. But if they're in the car, I just calmly have one of our team members go out there with a portable carrier. And I say, we say to them, our policy is that our cats come into our hospital for their safety in a carrier. So we're going to have them come in this carrier and we're going to bring your cat out to you in this carrier. You can just bring it back or just keep it, right? Depending on how disposable it is. Most clients at that moment are pretty amenable to that. We've had a couple clients who say, my cat will never go in a carrier. I refuse. And we just tell them, then we're not going to see them. And people sometimes when I say that, people are like, what? You won't see them? Yes, we won't see them, right? Because what's going to end up happening with that cat is it never fails, right? Because this happens with dogs too, who don't come in on leash, is we live in urban Chicago and it's a busy street. And that cat who's not in a carrier and not restrained in any way, doesn't know us at all, and is hearing sights and sounds and has probably never been out of the house. And as soon as we take that cat, it's going to scratch or bite because of fear, anxiety, and stress, and run and unfortunately potentially get hit by a car or have something else traumatic happen to it. It is not safe for the cat. It is not safe for your team. It is not worth the risk at all. We've had 2 clients leave and be very frustrated that we won't do that. And within 6 months, come back with their cats in a carrier because they'll find that most clinics have the same policy. So I would encourage you, for your safety and your team's safety and the cat safety, that those carriers are brought out to the car, and that is the only way that you will bring those cats into the hospital.
That is a great response. And the next question that we have here is something that I'm sure everybody has come up with over this past year: euthanasias while social distancing.
I know.
How and what tips and what advice do you have on maintaining that empathy and that connection while still maintaining everyone's safety?
Absolutely. And I'm so glad that came up because euthanasia is typically one of the processes within a hospital that helps really reinforce human animal bond and human to human bond, right? I think we probably can all think in our head the clients that really mean almost like, kind of like family level to us. We've been through euthanasia together, right? We've grieved together. We've been emotional together. We've been vulnerable together. And that's very hard to do dressed in PPE and staying far away. And I'm a hugger. So for me to not be able to do that with my clients has been very hard. I would suggest a few things that have helped me still provide empathy, still provide compassion, still provide support while still being safe publicly, right? So the first thing is to make sure that if those patients can tolerate it, that they come in on a PVP so that we don't have to deal with an anxious patient of any kind. Certainly I try to do this for all of our euthanasias, but especially if it's a sudden need for euthanasia or unfortunately a behavioral case that can be very challenging, especially emotionally, have them come in relaxed. If they're not relaxed, even on a PVP, we want to instantly get them some type of injectable sedative so they're relaxed. The second thing is that we want to be with those patients, right? But we want to be safe. So after we've put in an IV catheter, of course, we just do an extension line so that the parent can be holding their family member. We can still be in the room and we can still administer Euthanasol safely. For me, I feel comfortable myself because we provide masks for, we allow one parent inside the hospital. And so we provide masks and we provide gloves. I myself feel comfortable if I'm masked, I'm vaccinated, and the other person is masked, holding hand. So I will touch the top of a hand and squeeze and hold for a minute and tell them how incredibly sorry I am for the pain they're feeling. Most clients are thrilled to have somebody touch them that way. I think that is a very professional way to do that. I don't think that I haven't had anybody jolt back or not squeeze back or feel or show body language that's uncomfortable. In fact, most parents release their shoulders and cry. And so I think that's a kind of a compromise. I used to hug people. I used to get right in there and let them cry on my shoulder. And now it's a handhold with a glove. And I think that creates empathy. I also am very big about eye contact. I think it's incredibly important to show them in the eye how incredibly sorry you are for their loss. We can't say that we know their pain. We felt similar pain, but we don't know their pain. That we're a resource for them, that we're here to support them, that they need to let us know, do they need to tell their kids? Do they, their spouse is out of town, whatever it is, how can we be there for them? We give clay paws. I hope all of you are doing something similar to take home. We often will give hair for lockets. We offer to take pictures. You'd be surprised how many clients are really thrilled to have an emotional last moment captured on their phone. It's not for everybody, but we offer. I think there's ways that you can, again, stay across the room, but be present. I think that's what it has to be. You have to show that you are in the moment. Nothing else matters. Even though you can't be next to them on the couch or lying on the floor, you are with them and they know you're there. So that's the best way that I've found. And again, please, if you aren't doing this, please follow up with them the next day. It can't be a team member. It needs to be you. It needs to be you.
Such an important point there. Thank you for including that. Next question here, also a hard one. Finding during COVID, we're having a lot more clients come in hard financial situations. How are you addressing this? Has it changed with the pandemic? What resources are you recommending for clients that are struggling?
Yeah. And this is right where we absolutely need to start by listening and having empathy. This is, if we remember the inhale, exhale technique of imagining that client's position, this is where we absolutely need to imagine how we would feel a lot of people, like their pet was their entire life through COVID, right? A lot of our seniors who are alone, a lot of, people who lost a family member to COVID. This was their sanctuary is their pet. For them to then find their pet ill, we now then have this incredibly difficult position that we're in because we want to help the pet, right? We're healers. We want to fix the problem. The client wants to help their pet, but we have this impasse financially. So a couple different things you can think about doing. One is the AVMF, right? The American Veterinary Medical Foundation has opportunities for funding for some of these patients. So you can, again, either go through AVMA to find them or AVMF. A lot of companies have been donating to that fund. So very important resource for all of you to offer to clients. Number two is, how can we be creative with our care? Things like utilizing our online pharmacy. So let's say a patient comes in and all of a sudden now the patient's diabetic, and you're telling the client all of the things that they have to do, and you can just see the client just collapsing and going, I can't afford this. I'm going to have to euthanize my pet. That's never the line you want to hear, but many of us have heard that this year. So instead, how can we, in our mind, of course, we want to do gold standard, but how can we provide standard of care divided across time so a client can budget, if that helps them? How can we utilize, as an example, heartworm prevention through an online pharmacy? We don't have to give them 12 months today. We can set it up so they get it a month at a time to help with their budget. We don't have to give them a 27-pound bag of food. We can start with a 7-pound bag and let them order online. We can do creative measures within our practice and also talk about care credit and other financing things if they want to. There are angel funds a lot of times within your own city. As an example, where I am in Chicago, the Chicago VMA has funds that they've set up through foundations. Many VMAs have those types of resources set up. So look in your state, if you had in a larger city that has their own VMA, many of them will have those type of ancillary financial support applications. Work with your local shelters. Many of them have care clinics that will be able to help service clients in financial need temporarily. If they need vaccine updates, if they need low-cost spay neuter. This is a time not for us to get possessive over clients, if that makes sense. We need to help our clients and we need to give them resources. And the clients that I have offered these resources to have been filled with gratitude and has just solidified their trust in us. And they come back when they're in a better place. And we would hope that they would do the same for us if the tables were turned. Again, inhale, exhale, imagining, listening to the client, having empathy, and showing them that we are there to support them. So again, in practice, be creative in your thinking about cases, utilizing online pharmacy, utilizing shelters, VMAs, AVMF for some of those angel funds, thinking about how can I provide standard of care, but maybe today it can't be the gold standard that's in my mind. We're still helping that patient. And believe me, that pet parent who is struggling to even pay their rent, pay their car payment, and now is looking at their life in front of them, their cat or dog that is bonded to them immensely, and they can't provide care. That is a guilt none of us want to have to go to bed with either. So I think that's probably the best strategy I can offer right now. And if I think of more resources, I'll certainly put them in the chat.
Thank you. And we are going to wrap up here. The last question we are going to answer, just being respectful of everybody's time tonight, is how do you approach clients that are doing curbside and leave during their appointment?
Isn't that fun? You're like, where are you? They're like, I'm at Target getting my groceries, or I went to get my hair done. Yeah, that thankfully isn't happening as often as it used to, but I absolutely empathize with you because that is so frustrating. So a couple things. One is that won't happen as often, again, with this pre-appointment communication you're going to send out. Because unless you're doing a drop-off appointment, which implies that they can go do whatever they want, right, for those 6 hours or 4 hours, it implies that we communicate that during your exam, you either need to be outside if you didn't come by car, or in your car in the parking lot, because we need to be able to communicate with you and be able to potentially bring your patient back out if they're getting too anxious or need to talk to you in person. So that is very important, and we stress that all the time. That should be in social media, that should be in your emails, that should be in any call that you're talking about, is that just because you're not in the building, you are still here. Now, if a client leaves during that exam, then we tell them, well, unfortunately, we need to move on. So we're going to treat Fluffy as a drop-off appointment now. So let's say it's 10 o'clock and they've chosen to leave. Well, Fluffy is now going to be, in our, what we call our fear-free area. We have to move on. And so we'd love to set up a time at 1 o'clock or whatever, you have a small break, to regroup with you. And thank you so much for your patience. Why don't you get a few more errands done, and we'll see you in a few hours. Most of our clients, we have a few that go, what? Are you crazy? I'll be back in 10 minutes. And we're like, we gave you the pre-appointment communication. You probably have a few more errands to do. Why don't you go ahead or go take a walk? It's a beautiful day. Some of those clients that have really complained, we'll give them a Starbucks gift card and say, this time we understand, but this is not how we operate. It's been very difficult through COVID, and we really appreciate your understanding in that matter. And a lot of times they'll go get a coffee or a Frappuccino or something. It's across the street. They'll chill out a little bit, and then they're totally fine. And remember, we can't deflect, get defensive or frustrated. We can't take it personally, right? Especially if we haven't, as a practice, done a great job of explaining that appointment communication of what happens. So just make a mental note. If you had a couple of those, let me check my pre-appointment email. Let me check our social media. Let me check our website. Make sure it's very clear that they need to stay in their car or outside or in the waiting area, wherever that is at your practice, during their exam appointment time, so that we don't end up with those very frustrating times when you are trying to reach them and obviously they're nowhere to be found.
Well, thank you so much, Dr. Marks, for a great presentation tonight. Thank you to Elanco, and thank you to everyone for joining the webinar. You will be able to find a recording of this webinar on fearfreepets.com within the next week. And this presentation does count for 1 hour of Fear-Free CE that you can add to your tracker in your account at fearfreepets.com as well. So thank you again to everybody. We had a great time spending the night with you this evening, and have a great night.
Yeah, thank you to everyone. Feel free to email if we didn't get to your question, or if you have anything else you want to discuss. And please take care of yourself and your families.
Take care, everyone.